as we spend more time sitting in chairs and on couches, it's going to be inevitable that our hips get tight. Now, I was working with a client named Jamie whose back pain prevented her from standing upright for long periods of time. She wasn't able to stand and watch her kids play soccer, and she couldn't even stand at the grocery store checkout line. She needed help. Now, when evaluating her, the most obvious position that I saw was that she wasn't able to stand up straight. In fact, her low back was so curved that it looked like her buttocks were pointing straight out, and she also reported having really tight hamstrings. Since she could barely stand, it really made no sense for me to test her with a goblet banded hold for her. It would have caused her a lot more pain and discomfort. I could have stretched her hamstrings, but she already did that in the past with little to no effect. She had an anterior pelvic tilt. And when it comes to the hamstrings, more often than not, tight hamstring muscles are not the cause of the tilt, but more of a result of it. And so that would be like putting a band-aid on a problem, hoping that it would just get resolved spontaneously. So in our first session, I actually had Jamie lay on her back and complete what is called the posterior pelvic tilt. It's a very low threshold, meaning very easy to position for most folks, and had her knees bent to alleviate any tension in her hips. In this position, the low back would often be off the floor or table due to the curve of the spine, and that's totally okay. And here's what we did next. The first step was we focused on breathing to just calm down the nervous system. There are a few breathing exercises that are found on our YouTube channel, so make sure you check us out on YouTube. Once the nervous system was calmed down, we then focused on actually pulling the ribs and pelvis together by driving the low back into the floor. Now notice I said pull the low back into the floor as compared to drawing the belly button in, which you would often hear other people say. Now when drawing the belly button in would actually cause you to suck in your stomach, and that's not what we wanted. And so we pushed the low back into the floor and contracted those abs, and we held this position for 5 seconds and then gently returned to resting. We repeated this for about 5 to 10 repetitions. Now, upon standing up, Jamie's back pain was actually cut down to about 50%, and she was able to stand up straighter. What we did was that we put her body in a position of success and engaged her anterior midline, which is also known as her abs, and really relieved some of the tension in her back. Now, if your back is feeling cranky and it's a little bit arched because of this tilted pelvis, try it at home for a few repetitions. Tomorrow, I'm actually going to share with you a little bit of anatomy on the anterior pelvic tilt so you have a better idea of how you can fix it. Stay tuned.